So, doctor, today we want you to teach us about health in children. We want you to help us to know more about children's health.
So, doctor, what does it mean for a child to be healthy?
Basically, most people misunderstand health as not being sick, but health is a big thing that's not only being sick, but also being mentally stable. Most children nowadays, they face of many mental challenges and they can't speak out. That's not being healthy if you are battling mental health. So also being physically fit, that's being healthy. Like you don't have any maybe fracture, you don't have any joint pains. Yeah, that's also being healthy. So to most kids, they think being not healthy, it's being sick, maybe with fevers, with cough. But health, it's being healthy irrespective of the diseases you have. For example, some children have sickle cell and they keep healthy, taking the right medication to keep their blood levels okay. Some children are born with HIV, but they keep healthy, taking their antiretroviral medicines very well, and they stay healthy as normal as other kids be. So health is a state of being physically fit, mentally stable, irrespective of the diseases you have. You may be having diabetes as a child, but when you keep taking the medication and your blood sugar levels stay at a good level or normal level. So that's what I can say about health. Thank you.
Doctor, why is good health important to school children?
Yeah, good health is very important because as a child and you're in school, you need to be healthy for you to be able to concentrate in class and carry out the assignment as assigned by the teachers. So being physically stable, mentally stable, you may go in class when you're having maybe something bad is happening to you at home. Take for example, children who are living with maybe stepmothers, they tend to battle a lot of mental health challenges. Maybe they are mistreated. So when this child comes in within school, they cannot be able to function very well because they are having a lot of stuff happening behind them. Talk about a child who is having stigma, maybe at school being bullied. That is also not being healthy to be having a good concentration in class, so it affects the child's performance within class. Yeah.
Oh, thank you so much. What are some simple habits children can practice every day to stay healthy?
Yeah, basically, as I told you in the first place, being physically fit and also mentally stable. So physically fit, one, to be healthy, you need to exercise, like doing normal playing exercises like running, skipping ropes. Besides physical activities, you can eat healthy foods. Eating healthy foods like fruits, you do a lot of fruits and water, that's eating healthy. Don't do too much of KFC because that's not being healthy. Okay. Eating junk foods, that brings a lot of complications along the way. Like it puts you at risks of getting heart diseases if you eat too much salts in your food, eating too much fats in your food. Then also sleeping well. It's also very important. Nowadays we are having perspective of children being with gadgets like phones, being too much on TikTok, being too much on WhatsApp. That's not being healthy. If you tend to sleep very late and maybe you're having like 6 hours, 5 hours of sleep or 4 hours of sleep, then the next day you have to go to school. That's not being healthy. So practicing good sleeping habits is also key. Like a normal child should sleep at least 8 to 10 hours within a day. Yeah.
So why is it important for children to eat healthy food?
Healthy foods help you to boost your immunity. Okay. Yes. They also help you to boost your brain function and also brain development. That's the key in children's growth. Yeah.
Oh, okay. How important are sleeping, exercise, healthy food, and drinking water?
Pardon?
How important are sleeping, exercise, healthy food, and drinking water?
These ones are very important. Normally about the brain development. Brain development, it composes of many things at a go. Eating healthy to ensure that your brain develops very well so that you can be able to understand what is being taught in class. So eating well, exercising well. Exercise besides your physical fitness, but also boosts your normal functions of the brain. Exercise is also good. It also reduces, if you're having many stresses as a child, when you keep on exercising, playing with others, it helps also to boost your way of thinking and also the way of doing things. Yeah.
Doctor, question please.
Yeah.
You have talked about feeding on healthy food helps you to boost your immunity.
Yeah.
How does it help you to boost your immunity?
Yeah, eating food as a child which is healthy, more fruits, okay,
Yes.
proteins, you balance it. There are some kids who overdo. There's what we call overnutrition, like you do a lot of fats in your food, put jam, you eat a lot of sugar in your food. That is overnutrition. You find that a child is of maybe 6 years, but when he's too fat, that's not eating healthy. So this food you take, being like in a balanced diet, it helps you to see that you grow well and you think very well in class and everything is on point as a child. Yeah.
Oh, that's great.
What are the most common diseases children get?
Basically, I'll start by defining what diseases are and what causes diseases. Okay, so basically, children are very susceptible to getting infection or diseases. Diseases are caused by different microorganisms, and when I say microorganism to a child who is there, these are things that you can't see with your naked eyes. We can only be seen by use of a microscope. There is an instrument that I have in my office, which is a microscope, which I usually visualize microorganisms when a child comes in my office and we do tests, whereby I can visualize and say, this child is sick of this and this child is just sick of this. So in our environments where we pray from, maybe at home, maybe at school, anywhere, always germs or infections are always surrounding us as children. So children, they may think that a clean maybe floor, it's fine. That's not true. Basically, those germs, you cannot see them. They are composed of viruses, they are composed of bacteria, they are composed of parasites. So let me break one at a go. So viruses, these ones, like, they can be transmitted from one person to another through the air we breathe in. For example, the COVID time, COVID-19, when it came, we used to get that kind of virus through coughing and sneezing. When you are near a person who is coughing and sneezing, then you get such a virus. Let me talk about the school environment as children. Nowadays, you find that school environments are always crowded with many children in class, many children within the compounds. So you find during the break time, children tend to share, which is also good. But I believe sharing should be at certain limits. For example, if you're having a bottle of water, maybe a bottle of juice, and your friend asks you, can we share? Then use the same bottle. Remember, these diseases, you can get them through contact. You share the bottle, the child is having cough or having flu, you end up also getting flu from your friend.
Now, you as doctors, during this time of Ebola, what are you planning to do in order to control Ebola?
Yeah, basically about Ebola, we need to know how Ebola is caused and how to prevent it. Ebola, it's by contact. We get it by contact. For example, if a child is near you or your friend is near you having Ebola, maybe it's having high fevers,
Yes.
having vomiting, this child should be taken out of school and seek for medical attention.
Can Ebola be treated when it is still early?
Yeah, Ebola is, remember I told you about diseases being caused by viruses, bacteria. So Ebola is a viral disease whereby we don't have specific treatment as far as Ebola treatment is concerned. But being a virus, it can be, you are given supportive treatment and the body fights it naturally. So in most cases, most people who tend to get Ebola, they can fight the disease by strong immunity. Immunity, when it's the defense mechanism of your body. When you do exercise, eat a lot of fruits in your diet, take a lot of water, yes, you can get cure depending on your body immunity. Yeah.
Oh,
So can Ebola get cured?
Yes, it can be cured when you're having supportive treatment. Seek for medical guidance early when you're having symptoms of fever, vomiting, diarrhea, or even having bloody discharges. Those are at later stages. So to children out there, when you feel like you are sick, you are not feeling well, you should tell your mom, your teacher, you are not feeling well, so that you get treatment very fast, irrespective of which disease. Yeah.
Okay, let us first go for a short commercial break. You're still watching UG Kids on TV1. Stay tuned.
Welcome back from that short commercial break. We are still here with Dr. Geoffrey.
So, Dr. Geoffrey, why should children wash their hands?
Yeah, as we started on this show, we are more on focusing how kids get sick, okay?
Yeah.
So I was telling you about viruses, bacteria. I did not talk about bacteria. So the viruses, I gave you an example like COVID-19, like flu. Those ones get through by air, also by contact. Then you have bacteria. Bacteria, these ones we get from the food we eat, okay?
Yes.
Eating something which you have left there not covered. Okay? Eating something that you have stayed for so long. Then we have parasites. Parasites talk about malaria. Normally malaria gets through uninfected Haemophilus mosquito when it bites you during nights when you're sleeping. Yes. Maybe you're not sleeping under a mosquito net. That's how also you get malaria, such a parasites. There are some parasites that we get from eating contaminated food still, like those worms. Those worms. Sometimes kids, when they have too much worms within their body system, they tend to feel itchy around their anus, okay? So such diseases come in through eating contaminated food and also drinking contaminated water. If you take water which is not boiled, then you get what? Typhoid from the water. When you get water which maybe you have got from a dirty place, you get waterborne diseases. So when you eat food which is not covered, which is not warm, you get bacteria. Then you come, my stomach is, I'm feeling stomach upset, I'm having fevers. In most cases, children come with their parents at our facilities when they think it's malaria. But when it's not malaria, because of high fevers, vomiting, but when it's bacteria, because of eating contaminated what? Food. Yeah.
So doctor, how can you know that someone had a food poisoning?
There are many symptoms that arise when a person eats something contaminated. It doesn't happen suddenly. Maybe if you eat it today, it can take about 3 days to get those symptoms and signs like fever, diarrhea, stomach pains. That's the way it is.
So how can you prevent a child from getting? How can a child be prevented from getting ulcers?
Ulcers, when we say ulcers, those are wounds within the stomach walls. So wounds within the stomach walls, it depends on the lifestyle of that child. When I say lifestyle, how this child tends to eat, what the child eats, and when this child eats. For example, if a child doesn't want to eat, then it makes the stomach empty for so long. So when this stomach is left empty for so long, it brings, remember the stomach, in the stomach we have what we call hydrochloric acid, which the body tends to secrete often when you eat food. But it comes a time when the stomach is empty for so long. So this acid will find the stomach wall when it is empty and burns the stomach wall. Then you get those ones called the ulcers. That is one perspective. Then another thing, when you eat too much of oily foods within your diet, most especially when you concentrate too much of junk foods, eating too much oil within your food, you tend to increase body secretion of hydrochloric acid within your stomach. The acid within your stomach tends to increase. That's also one aspect if you get ulcers. Then there is an ulcer which is brought by a bacteria called H. pylori. Okay, this one you get it from contaminated food. It's a bacteria that tends to eat your stomach walls, then brings about those wounds within your stomach walls. So those are many perspectives we get ulcers within our lifestyles. So the best way to prevent, one, the bacteria, you need to eat when you have washed your hands. You need to eat food when it's still warm. Cover your food when you have left it so that it does not get contaminated. Then on the perspective of lifestyle, eating too much of oily food, not eating, you don't want to eat, you are tend to be on your tab or laptop, you miss food, lunch, you miss breakfast, you miss because you are doing too much on your gadgets. That also tends to bring about ulcers. So a child should be advised always by a parent when it's time to eat to try eat something, and also reducing too much oil within their food. Yeah.
I've ever heard that ulcers, peptic ulcers, they cause cancer.
Yes.
Is it true?
Yes, it is very true.
How?
When ulcers are not treated for so long,
Yes.
remember, when a wound starts small, it keeps on growing. If you don't change the other lifestyle I told you, like eating more of fruits, reducing on junk
Oils.
foods, those oily stuff, trying to be hygienically clean, washing of your hands before eating, trying to eat food which is warm, try to see that when you leave your food, you cover it, then you warm it afterwards. So if you don't do that, then these wounds which are very small, they keep increasing in size within your stomach walls. In the long run, they tend to bring about what we call cancers, stomach cancers. It does. And even the other bacteria I told you, the H. pylori, which we get from contaminated food, it's also one of the major causes of stomach ulcers within our environment.
Dr. Godfred, what causes H. pylori virus? Is it?
It's a bacteria.
Bacteria.
Yeah.
What causes it?
That's the bacteria which is called H. pylori, Helicobacter bacteria. This one, we get it from contaminated food. The food which is contaminated by the same bacteria. So the food should be cooked very well.
Yes.
Use clean hands. Wash your hands with soap before eating anything. It should be a snack or what. You should have washed your hands. Remember, when you go out there and pray within our environment, you touch everywhere. Whereby I told you, environment can seem to be clean, but remember, microorganisms, you cannot see them with your naked eyes.
Yes.
They are visible. You pick them, then you contaminate the food, then you, as you eat, then the stomach gets what? Infected by that bacteria.
Okay.
How can good hygiene help us avoid diseases?
Yeah, good hygiene is very important to any child out there. Remember, good hygiene starts with washing your hands. Daily washing your hands, it's very crucial in your life. Usually I do wash my hands, I don't know how many times in a day. Because every client I have to touch on, I have to wash my hands.
That was
Every
my
sample that
message,
I have to wash my hands. So hand washing should be a daily practice and should be adopted within all schools. Irrespective that the child is going to eat, maybe from the toy you have to wash your hands. Before you eat, you have to wash your hands. After playing, you have to wash your hands. So frequent hand washing is very crucial. Yeah, and this one helps to prevent diseases which may cause you to be sick, even leading to death. So it's very important to practice good hygiene.
So is it true that ulcers kill?
Yes, ulcers do kill if they're not treated. Remember, these are wounds. When they keep growing within your stomach, the wound that started very small, it keeps enlarging. Bleeding may come, internal bleeding, when you don't know. You find a child is having too much anemia. That's lack of blood.
It's anemia.
Anemia, this
Blood
is
passing through
yeah,
your-
this is low blood within your system. Yeah, there are normal ranges as we tend to get your blood, then we measure, then we get to know you are having less blood in your body or a normal blood level within your body. So ulcers, when you get them, you bleed within the stomach walls. So if you're not taken to the hospital to check really, you may find a child dies of anemia. Another thing, ulcers can also bring about stomach cancers. If you're not attended to early, cancers can come within your stomach and affect other organs, then the child dies at long run.
By the way, even us at our school, last time we lost a child
Yeah.
because of ulcers.
Yes. Also, we had an incident whereby a child was having too much ulcers, chronic, and this child was bleeding internally. And the only thing that could save this child was to do a surgery to close up those wounds. Yeah. So it's really a terrible disease, and parents out there, they should try to revise what kids eat and also practicing good hand hygiene. Yeah.
Thank you for teaching me. I have ulcers.
Yeah, you should adjust. Now, if you're having ulcers, have a positive mindset. Try to work on what you eat. More if you're having ulcers, reduce on fatty foods. Don't do a jam on your butter, on your bread. try to see that you stop eating more fried stuff, do more fruits and water, eat in time. Yeah.
Mommy used to stop me from eating oily things.
Yeah,
and
that's
I
the
never
best
used
way.
to listen.
Yeah, that's the best way.
Even eating noodles, sometimes they
Yeah,
can
because
say
they have oil on them.
Noodles.
So yeah, if you're having ulcers, you need to go to the health facility. They tend to know what's the cause. If it's the bacteria, they give you those antibiotics, the drugs that treat the bacteria. Then if you're having lifestyle, which is eating more of chicken, which is fried chips, stop it so that the wounds tends to heal. Then also eating in time, hand washing frequently before eating, and also keeping your food safe, covering it, warming it before eating.
Why is it important to brush our teeth and bathe regularly?
Yeah, brushing the teeth, it's very crucial because it prevents from getting dental caries. You get dental decays, which when you have them, the bacteria will be invited in your mouth. Then they cause tooth decay, which tooth decay will bring your teeth to pain. And in the long run, sometimes you lose your teeth, or you find that your mouth is even swollen because of much bacteria within your gum.
So is it true that when you eat a lot of snacks and you get you get a tooth decay?
Yeah, snacks tends to bring the risks of getting those tooth decay. For example, if you are too much of eating biscuits, remember biscuits, most of them, they are so salty, they are so sugary, so they invite the bacteria within your tooth, and because of that environment, the bacteria tends to grow so much within that environment. So the teeth then gets the enamel, which is the outer part of the skin, that hard part, the white one. When it decays, you find that the hole comes in, then more food will keep going in that tooth. Then afterwards, it starts paining you, the germs keep producing within that tooth. Then you find that at one point, you are having a swollen gum. So that's how snacks can increase.
When I was young, I used to eat a lot of biscuits. I got a tooth decay on these two teeth and also on this sharp teeth here. My teeth started becoming black. Then they removed them.
Yeah, it's not good for children to always do a lot of biscuits, sweets, because it increases chances of tooth decay. Because such bacteria, they like that environment which is kind of sweet. So you attract more bacteria within your oral cavity.
So eating sweets, it is bad.
It's not bad, but it's bad when you overeat sweets. Yeah.
So you can
should be done in once in a while. Not every day I have to eat sweets and snacks.
Oh.
Once in a while. For me, I don't do like sugary stuff. I do them once in a while.
What health habits should children practice at school?
As I told you in the first place, more of washing hands, then also doing PE, that's very important. But also in the school environment, in the school setting, children should not be running around the compound because this tends to bring risks of getting accidents at school. So the environment where you play from, you may be running up and down, then you fall down, maybe you hit a stone. That's not good because health, it's not about being sick, but also physically fit. Yeah.
So how important is being physically fit?
Physically
children?
fit, yeah, physically fit, it boosts your immunity. When you do exercise, it boosts your immunity. It brings your brain also to remove stressing factors that you had. Yeah, physically fit is very important. Exercising as a child is very important. Okay. But don't do vigorous exercise, simple exercise like taking a walk, running like that, skipping a rope. Yeah.
What advice do you have for children who spend too much time watching television or using phones?
Remember during our first session, we talked about having enough time to rest. So rest is very important. Resting like 8 hours within a day. So when a child spends more time on phone, on their gadgets, they tend to feed a lot of content from what they are viewing other than feeding a lot of content from class. Remember, the brain, it's composed of what we call the neurons, whereby what you feed on your brain more, it's what you think more. So when you feed more of your brain with a lot of maybe TikTok stuff, Facebook stuff as a child, then you may not leave room for classwork. So children should be limited on how to use gadgets and when to use them, and also limit them to have enough resting.
So doctor, there's this disease I want to ask you about. As asthma. What happens when you get asthma?
Asthma, it's a chronic disease whereby when a person is having asthma, they don't get cure from it. And it's a non-communicable disease. When I talk about non-communicable disease, these are diseases which we get through maybe our parents, inheriting them through our DNA composition. So asthma, you cannot get it from maybe eating something from your friend. You cannot get it from maybe drinking water. And at one point, asthma can also come because of exposure to many like things like cold. When you're a child who is always playing in cold environment, maybe at your home you have AC, you put it at lower degrees every time, you're at risk of developing asthma even if you're not born with it. Then besides that, if maybe your grandfather or your parent, maybe they had somebody who had asthma, it's within your composition that you have high chances maybe to be born with what? Asthma. So the best way is to go to the health facility with the child. They tend to advise you what to do and what not to do when you're having asthma. For example, for more children with asthma, we tend to advise them to always treat cough and flu very fast because it triggers the reactions to those adverse effects of asthmatic children. Then if it's cold weather, like when it's rainy season, we tend to tell the parents to see that these children are always kept warm, wearing jackets. If this child is at school, and teachers should be also addressed to this child's needs. You get? For example, if a parent out there, you're having a child who is asthmatic, the school staffs should get to know. Remember, at school, sometimes you are not allowed to wear a sweater which is not part of the school uniform. So remember, these sweaters are not so like heavy to keep a child warm. We tend to tell these children, please at school tell the teachers to know about the child's condition, so that children are allowed to put on heavy clothes even if it's not a school uniform. Yeah.
So my friend at school, the brother had sickle cells.
Yeah.
But does sickle cells get cured?
Sickle cell does not get cured still. It's more like asthma, because we classify it as a non-communicable disease. You cannot get sickle cell from touching a friend. If your friend is having sickle cell, you need to support them as children. Don't chase them away. You're having sickle cell. That's causing a lot of stigma to these children.
Yes.
They need to have a supportive environment. You cannot get sickle cell from sharing their food with you. That's one thing children should know. Then sickle cell is got from maybe if your parent, one of your parent, they are carriers and the other one is a carrier of sickle cell disease, they tend to produce a child who is having sickle cell. So we receive sickle cell from our genetics composition or from our parents. You get the point?
Yes.
So it cannot get cured because it's there. You find that your red blood cell, when we say red blood cells, these are the cells that transport oxygen within our body system. The blood, the red blood cells, their function is transport oxygen within our body system. So for people who are sicklers, who are having sickle cell disease, their red blood cell, it's of a normal abnormal shape. It's of a sickle shape. A normal red blood cell is kind of circular, but for a sickle cell sickler child, for his or her red blood cells, they are in a sickle cell form. So what's the key component in there? The key component in that, remember I've told you the red blood cells, their main function is transport oxygen within our body parts or body cells. So for a sickler, they are having limited oxygen supply within their what? Body demands. So they tend to have many difficult moments and difficult sin blizzards at one point, pains within, you get the point. So even lack of enough blood, which is one of the major signs. So it cannot get cured. We just give medication that keeps the blood level at a normal range, supplements. They tend to eat more fruits within their diet, take a lot of water. So it is manageable, and any child who is out there, if you're having sickle cell, it's always manageable and you can live a healthy life irrespective of any disease. Remember, in the first place I told you, health is not having a disease, or like most people understand health that if a person is sickle cell disease, they are not healthy. Children who are sickle cell disease, they are also healthy if they are given right treatment to manage the disease and they stay healthy. Children who are HIV positive, who are born with HIV, they are also healthy if these children are taking their medication very well and the virus is controlled. A child who is having asthma, if they do what I told you in the first place, wearing heavy clothes when it's cold, not being exposed in that dusty environment, they also stay healthy. You get it? So healthy is being physically fit, mentally stable, irrespective of any disease you have. If it's within the control of the normal ranges, then you are healthy. Even if you're having diabetes, like a child, you are taking on your medication very well, and when we measure your blood sugars, they're always at a normal range. That is also healthy. Yeah.
So I hear some children saying that sickle cell can also be spread through saliva. Is it true?
No. That is causing stigma within schools, and a public health advocate, I advocate for reducing stigma within our environment. Last time I was sharing with my good friend Dr. Semakula how we can advocate for reducing stigma about chronic illnesses. Chronic illnesses, these are diseases that cannot cure. For example, sickle cell, HIV, diabetes, okay? They are chronic because they are there, but they are manageable. So as parents out there, even headmistresses, director within your schools, please have a supportive environment for children who are having chronic illnesses to be supported. Remember, these diseases cannot be spread from one child to another if they share maybe food, even HIV. HIV cannot be spread through contact, cannot be spread from sharing a cup with another. HIV can be spread through blood contamination. If you get a cut and maybe another child gets a cut, then you can get HIV. You get HIV cannot spread through saliva, so same as to the sickle cell disease, even asthma. Yeah. Thank you.
Doctor, another question. That our class teacher told us that you may be having HIV, but when you don't have AIDS.
Yeah.
Is it true?
Very, very, very true. And I'm an advocate for improving on HIV health out there in communities. As my foundation, we run a program called Integrated Community Service Delivery Model, where we focus more on community support of people who are infected or living with HIV, and also those who are affected, living and affected. For example, if I'm living with HIV, that's me having the virus. Then those people who are affected. For example, you may find a wife is having a husband who is HIV positive, but the wife is affected emotionally, physically. You get the point?
Yes.
So, HIV, repeat the question?
Like, I'm saying, like, maybe let me give an example. I'm having AIDS and she's having HIV.
Yeah.
Is she the one who's infected, or it is who's positive, or it is me who's having AIDS?
Okay. Now, most people confuse the two terms, HIV and AIDS. What is HIV? HIV, this is a virus that leads to AIDS. You get the point?
Yes.
It's a virus. Remember, in the first place, I told you how diseases, we get them through viruses, bacteria, and parasites. So HIV is also one of a virus. So when you get HIV, that's a virus in your blood.
Yes.
But when you get AIDS, this is when you don't go for treatment, then you start showing the signs and symptoms that you have the virus, which is called HIV. You get the point?
Yes.
So if a person gets HIV, like if today I get HIV in my system, it may take me like 4 years, 3 years, or 1 year to start showing the signs and symptoms, like getting skin rashes, getting fevers, getting diarrhea, like wasting, like my weight being reduced so drastically, getting TB. Those are signs and symptoms that a person presents that they have the virus called what? HIV. So if you start showing those signs and symptoms, it means you are having HIV in your blood. Then you are showing those signs that I've told you. That's when we say that you have AIDS, showing the signs and symptoms. But the two are different. The best way to manage that is through taking treatment. Like when you test that you're having HIV, you take treatment as directed by the health worker, then you stay healthy without any complication. Remember, health, it's being physically fit, mentally stable, irrespective of any disease you have. Yeah.
Okay, thank you so much, Doctor, for teaching us. We have learned how to be healthy, how to control ourselves. Thank you so much. It has been very nice to have you here. Abigail, do you have anything you want to tell our doctor?
Correction. I'm Destiny, not Abigail.
Jesus. Okay, Destiny, do you have anything to tell our doctor?
Thank you so much for teaching us, and I've learned so much. Which hospital do you treat in?
Yeah. Thank you so much for inviting me to this program, and I hope to meet you again for more of what I do in community. My vision is to empower so much people who are facing such challenges of stigma as far as chronic diseases are concerned, and my organization does that best. I work with Transcend Medical Foundation, which is a community-based organization. We are based in Machindye, where our offices are. We have also operations within Mulago, being in partnership with Bela Foundation with Uganda. We do on community HIV care. Our model is friendly. We try to help people, children out there, to show them that they are not alone. We are there to support them, irrespective of any challenges they face through. Every week we tend to reach many kids as possible within our communities. In schools, even we support them in schools. The last year, we had a program called School Health Program, teaching teachers within Kampala district, to teachers out there who are able to see me within your school environment, teaching them to reduce stigma to those children who are having chronic illnesses. It's not good to tell the child, go limurwadde. That's not bad. So teachers out there, we are still rolling out, trying to teach teachers to support these kids who are having chronic illness like asthma, HIV, sickle cell. You get the point? Yes. So my organization is Transcend Medical Foundation, and my numbers, those who want to get to know more about my services. Our services for most of the chronic illnesses are free of charge. They are free of charge. The medication is free of charge. The lab work we do in community is free of charge. We need to tell these children out there, you are not alone and we are with you. Yeah.
Okay, so
my number.
The number, yes.
Yeah, my number is 0779 67 11 91. Then my office line is 0755 35 2786. We work 24/7. Even if you call me and I'm not picking up, sometimes I'm having busy schedules, you do WhatsApp me. Yeah.
Okay, that's all what we have had from our doctor, Dr. Godfred. See you next time. You're still watching Yugi Kids. Until next Sunday. Bye-bye.
Thank you so much.